Hi everyone, I'm Dr. Karam. I'm a board-certified facial plastic surgeon and I specialize in facial rejuvenation. And today we're going to talk about men and facelifts. And we're going to go over some of the nuances that affect men, but also some of the things to consider if you're a man and you're considering a facelift. Here are some of the basics that go into it. So this is basically what it comes down to. The underlying motivation for undergoing a facelift tends to be the widening gap between the way we look and the way we feel. As we get older, our appearances start to change, our jawline and neck starts to sag as the deep fascia underlying the skin begins to elongate, and as a result, we no longer look exactly like we used to. And as that gap begins to widen, it becomes a little bit more of a point of personal contention and a sense of unease as we expect to look one way, we look a different way in photos and in mirrors, etc. And that leads to a motivation to want to address those changes. And the most principal and primary way to address them is by vertically repositioning the soft tissues back into position and regaining that youthful facial shape. And that can be accomplished. In my practice, I use a technique I developed called the vertical restore, but outside of my practice, terms like facelifts and things like that are the principal approach to jawline and neck rejuvenation. So looking as young as you feel is a very human sort of quality, and as we're living much longer than we had 100 years ago or so, we are starting to feel more of a desire to regain that balance between our appearance and our actual feeling of ourselves. So that is probably the number one motivation for men and women to undergo a procedure. The other ones come down to this overall sort of concept of ageism that exists through all the different cultures in the world, which is basically that as you age, you're not as productive, you're not as up to date, perhaps not as effective, etc. And for many men who are in professional roles, etc., that becomes a point of motivation to want to be in the same visual cohort as younger people and be viewed in that way. Now, as unfortunate as that is, it does tend to be a well-tested, well-researched phenomenon, but we also know that as we gain in age and work experience, our wisdom increases and our ability to be even more effective professionally increases, but sometimes it's about first impressions, and we all know the impact that first impressions make, and some of those two pieces really do come together as forming the underlying motivation for most men. And in fact, honestly, most women, so I don't think there's much of a difference there between motivational signals for wanting to do a facelift, but that tends to be the foundation of purpose and why. So now let's talk about the specifics. So anatomically, it does simply come down to the changes that are happening throughout the face. So what are those basic changes? And this, again, is a general commentary, not meant to be specific to each individual, but for the most part, we can say this, that after the age of 50 or so, the changes that exist in the human face as it ages is changes in the skin. We begin to see fine lines and wrinkles, loss of collagen, crepiness, etc. Then we see loss of volume as a secondary sort of vertical of change. We see loss of volume under the eyes, the temples, the lips, around the mouth and the jawline. Those fat pads in the deeper soft tissues begin to shrink. And then the third category is the elongation of the facial fascia. And that fundamentally is at the layer of the smas and the platysma, and also the eyelids and even the upper lip. So those areas are all elongating. Now, to put everything in perspective, elongation of the fascia and loss of volume have absolutely no preventative measure to them. Obviously, things can accelerate those, stressful lifestyle, poor diet and exercise, all those type of things can potentially speed up the aging process. Stress certainly is a major factor, but inevitably those changes will happen, whether they happen a little sooner or later, depending on lifestyle. Now, the one category that you actually do have a lot of control over is aging of the skin, and that's why I devote a lot of time and energy to explain, sun protection, the use of active ingredients, why I developed the Karam MD trifecta, specifically actually for men in a way, because using the comprehensive list of active ingredients needed to rejuvenate the skin effectively becomes a time-consuming and complicated process, and the trifecta simplifies that in 3 steps. But primarily to understand the skin is something that you, as the individual, have a lot of control over, the aging process, but the other things you don't. So when it comes to the laxity issues and volume loss, primarily the treatments are going to be surgical. So in my practice, I use fat transfer, restore volume, and then I use a technique I call the vertical restore to reposition the soft tissues back up into their original position. The vertical restore uses a deep plane, which in general I'm a fan of that category of facelift techniques because of its overall durability and its ability to release the soft tissue ligaments and put everything back into position with as little tension as possible, so that the overall result looks as natural as possible and you don't get that pulled and tight look. I like the vertical vector because, going back to kind of first principles, you want to look as young as you feel. You don't want to look like a different person, right? So in my evolution as a facial plastic surgeon, I recognize that the vertical vector, this upward vector, is a much more natural look than a side-to-side direction. So that is important, in my opinion, to always leave you looking as natural as possible as a basic principle, so that you don't feel uncomfortable in your own skin for a different reason, for looking different because of surgery. And certainly we've seen, unfortunately, many celebrities and people with that sort of a look, and it fundamentally forms a stigma. The basic principles, I would say, is a understanding that things like non-surgical treatments, fillers, etc., aren't going to lift the soft tissues. That becomes a surgical perspective. So point number 1. Point number 2, vertical vector is going to be much more natural looking, and that areas of volume loss are going to require things like fat transfer to replace the lost volume. Otherwise, you can use fillers in small amounts to replace that lost volume, but it will not substitute for the lifting effect. And that skin is something that is completely separate, and that belongs to you in terms of managing and working on it. I would say the primary nuance or difference between a male and female facelift is where the incision goes. In women, we tend to make the incision behind the tragus cartilage through here, and a little bit further hiding the incision. With men, at least in my practice, I make the incision pre-tragally, so I use a crease in front of the tragus to place the incision, for the simple reason that you don't want this bearded skin to be laying over the tragus, causing you to have to shave over that area, or just looks unusual and unnatural to have hair here. The incisions, even though they're placed in front of the ear, tend to heal well in most cases because of the fact that there's very little tension on the incision. So that's the nuance of that area. Now, the other component is men have short hair, sometimes we're balding, and again, in my particular approach, the vertical restore, the incisions have to be placed in the upper temporal region. Because we're lifting everything vertically, everything goes up this way, the incision has to go along the hairline and sometimes even track a little bit into the horizontal forehead crease. Now, the interesting thing is we've operated on a number of men with no hair, and that's the trade-off, obviously, that there's going to be an incision. I never tell patients that there's not going to be a visible incision. It just, realistically, it tends to be a very inconspicuous or very mild or hardly noticeable incision, and the gain is the overall improvement in facial shape. But typically, the incisions made in this particular area preserve the existing hairline as much as possible and tend to be as natural looking as possible. The areas behind the ear go into the crease behind the ear, and then a little bit further down into the neck, and a lot further down the neck if you have a lot of heaviness in the neck that needs to be lifted. So the incisional components are unique, following this kind of basic theme, but that's always a consideration for anyone undergoing any type of facelifting surgery, is that there is going to be a trade-off between the possibility of having a slightly noticeable scar and the advantage. I always tell people that it's kind of like you have to pick or choose. It's either you're going to have the sagging or you're going to have an incision, but the incision, like I said, for most people is worth the trade-off of improving the overall facial shape. When it comes to the eyes, and I'll just put this out there, it's very, very important to just simply remove excess skin or fat and not change the shape of the eye. So for the upper eyelids, it's almost always just the removal of excess skin. On the lower lids, depending on if there's bags and skin, I'll remove the extra skin and the extra fat all the time adding volume around that area to create that proper balance that you had during youth. So that fundamentally becomes the overall guidelines and considerations for a man who is considering facial rejuvenation. Please share this with friends or your spouses and give them some hope and opportunity to know that there is things that can be done and to leave people looking as natural as all the other before and afters that you see that come through my platform here. And if you haven't already, subscribe to the channel. We always aim to produce good educational material to make this entire topic of facial rejuvenation and skin rejuvenation as simple to understand as possible. Share it, and if you have any questions at all, drop them in the comments. I will do my best to answer them. And if you enjoyed this video, hit like. Thanks guys, I appreciate it. Until the next time, Dr. Amir Karam.